Good morning, everyone. Today we are discussing about tuberculosis. First of all, I introduced myself. Myself, Ms. S. Vijaya Samoondeeswari, Assistant Professor, Department of Microbiology, JJ College of Arts and Science, Autonomous, Pudukkottai. Now we want to know what is tuberculosis. Locally, we are called as this tuberculosis is TB. TB is an airborne disease. This is bacterial infections that does not spread easily. We generally have to be in close contact with a person who has its maze for a long time. We can contract TB without becoming ill or transmitting it to others. Here, about 1.4 billion people worldwide have TB. Most are sick, and also about 10 million people worldwide have active TB. Peoples with a weakened immune system. When the peoples have a weakened immune system, have the greatest risk of developing the disease. Symptoms can appear within a days of exposure. Sometimes for someone it takes months or years to activate. When the disease is active, that means the bacteria rapidly multiply and attack the lungs. And it can spread through your bloodstream in the serious stage, and the lymph node to other organs, bones, or skin also have the same infections. The tuberculosis, that is TB, is a dangerous and highly contagious bacterial disease. It is caused by Mycobacterium tuberculosis. What is Mycobacterium? Mycobacterium is one of the bacteria because we have the lot of microorganisms types, bacterial, fungi, that means to bacteria, fungi, algae, protozoa, viruses also cause the TB, sometimes in serious stage or secondary or third stage. But at the same time, mycobacterium is one of the bacterial cells. It is a immobile, slow growing, rod shaped gram positive bacteria with a high genomic GC content due to their special staining characteristics under the microscope, which is mediated by mycolic acid, which is present in the particular cell wall only. Because the mycolic acid, which is responsible for the Zell-Nielsen staining. In this way, the mycolic acids they have the capacity using the Zell-Nielsen methods. They have to appear in dark pink in color with dark background. They are called as acid fast. This is also the reason for the hardness of mycobacterium. What is mycolic acid? Mycolic acid. The mycolic acid, which is present in the cell wall of tubercle bacillus, containing fatty molecules known as mycolic acids, which make the bacteria less susceptible to antibiotics. These molecules also help the bacteria to subvert and then hide from the immune system. Next, we enter the introduction. Tuberculosis. Tuberculosis is a common and deadly infectious disease caused by mycobacteria, mainly Mycobacterium tuberculosis. The tuberculosis most commonly attack the lungs, that is, as primary complex, but can also affect the central nervous system and the lymphatic system and the circulatory system. Other bacteria such as Mycobacterium bovis and Mycobacterium africanum, Mycobacterium caneti, and Mycobacterium microti can also cause tuberculosis, but these species do not usually infect healthy adults. When someone immune system is weakened, already we told about the same way. When someone immune system is weakened, chances of developing TB are increased. An average 10% of infected individuals develop the disease during their lifetime. If left to untreated, the particular patients, the each person with a smear positive pulmonary TB will infect an average between 10 to 15 persons in year. Next, we enter sources of infections. The bacilli are spread through air because already we told it is one of the airborne diseases and also have the dangerous and contagious one. A person who is sick with TB disease, they have the symptoms cough, sing, sneeze, laugh, speaks, and or other person breathes the air into their lungs containing the TB bacteria. Direct sorry Dried bacilli in dust are much less infectious. The transmissions occur most often among household or other close contact with the infected person's sputum. Infections also occurs by ingestion of the material. Several other factors may be genetically susceptibility and age and stress, nutrition influence the outcome of the infection. So these are all the sources we have to receive the particular infection. Common symptoms of infection. Some of the common symptoms we had at the time of infection, that is cough 2 to 3 weeks or more, coughing up blood, chest pain, fever, night sweat, feeling weak and tiredness, and losing weight without trying anything, and finally decreased or no appetite. These are all the symptoms we have the basic in the time of TB infection. Next, we enter the pathogenesis of tuberculosis. The cycle of TB infections begins with the dispersion of Mycobacterium tuberculosis aerosols and the ingestion of the particular material. A dose of 1 or to 10 bacilli are dispersed throughout the air, making the risk of transmissions likely in patients long. The bacilli are phagocytized by alveolar macrophage cells, which then invade the underlying epithelium cells. Finally, we received the tuberculosis disease. Pathogenesis, the way of infections, how they are get a very serious stage. The droplet nuclei with the bacilli are inhaled either the lungs and deposit in alveoli. Then they have to formed macrophages, cytic cells, and T lymphocytes, and together to try to contain the infections by forming granulomas. In case weaker immune system, the walls lose integrity and the bacilli are able to escape and spread to other alveoli or other organs. In this way, we have this infections because the serious stage, the most of the lungs was totally damaged at the time of the infections. Immunopathology, the cycle of the TB infections begins with the dispersion of Mycobacterium tuberculosis aerosols. They have to enter into the body until we have to respond the delayed type of hypersensitivity response. Finally, we get tuberculosis. The coach phenomenon, cell-mediated immunity, develops 2 to 12 weeks after infections along with delayed hypersensitivity, that is called as the allergy. The result of this determines the cause of infection. The response of the tuberculosis animals to reinfections was originally described by Koch. The tuberculosis infected guinea pig, if injected with the live tubercle bacilli, the site around the infections becomes necrotic. Koch found the same reactions when injected with the old tuberculin. Heated at concentration of tubercle bacilli, it has produced the same reaction. This is called as a Koch phenomenon. This is the way of infection, how they are infect to the animals. In this way, and the human also have the same infection. Classification of TB. Classification of TB have the two different types. One is pulmonary tuberculosis and extrapulmonary tuberculosis. This is the way how they are classified in this way depending on the time of infection and response. TB may be classified as primary and secondary infection. The primary and secondary tuberculosis. Uh, Before that, what is meant by pulmonary tuberculosis? The pulmonary tuberculosis, it is an endemic infection affecting the lungs. It is further classified into pulmonary tuberculosis pneumonia, miliary tuberculosis, and a latent tuberculosis infection. The pulmonary tuberculosis associated with some of the symptoms, and miliary tuberculosis, the organisms which is appear in millet seed. In this way, latent tuberculosis infections mainly seen in those patients having bacteria within their body but do not display any of the symptoms of the disease. This infection is primarily detected through the tuberculin skin test. And extrapulmonary tuberculosis, nothing but it is usually seen in immunocompromised patients. There are several types. That is, yeah, tuberculosis meningitis, osteal tuberculosis, lymph node disease, renal tuberculosis, and adrenal tuberculosis. The primary tuberculosis, it is initiated after first contact with the tubercle bacilli, even of primary complex. The bacilli are engulfed by alveolar macrophages, multiply and give rise to subpleural focus of tuberculosis pneumoniae. Involve lower lobed and lower part of the upper lobe called Gohan focus. The hilar lymph node are also involved in this primary tuberculosis. The Gohan focus together with the hilary lymph node constitute the primary complex. The Gohan focus with enlarged lymph node appears after 3 to 8 weeks. We are getting the infections heal in 2 to 6 months calcified. Infections activated in immunocompromised conditions, example HIV infections and AIDS. It can produce meningitis, miliary, and other disseminated tuberculosis. The secondary tuberculosis mainly occurs due to the reactivation of latent infection, may also due to exogenous reinfections and also differ from primary infection. It is leads to cavitations of lungs, enlargement of lymph node, expectoration of bacteria, latent sputum, disseminations into lungs and other extra pulmonary area. Next, we enter the epidemiology. According to the World Health Organization, the WHO, nearly 2 billion people, one third of world populations, have been exposed to the tuberculosis pathogens. Annually, 8 million people become ill with the tuberculosis and 2 million people die from the disease worldwide. Death is recorded more in poor countries like India. More than 40% Indians are affected this infection from this infection. The reasoning for increasing incidence, the same infection rate, that is why it is having this reason HIV infections and the neglect of a TB control program. We are lacking the TB control program. The lack of access to healthcare. They have to identify the TB having patients, containing patients, and screening the patients. Next one is main reason for this instance is poverty. Laboratory diagnosis. Test may includes what are the tests we have to use for identifying the TB. That means to medical history, because the history is very helpful to identifying and processing the patient, how they are treated, how they want to treated during the time of this infections. And a chest x-ray, because we want to scan how much rate of infections the particular patients having the time of the infection, diseased state. Physical examinations and radiology, tuberculin skin test, microbiological detect of smear and the cultures. Finally, we test blood also. What is mean by direct smear microscopy? This is a staining method. The Ziel-Nielsen staining method. We do this. We do for identification of this tubercle bacilli. The direct smear microscopy of sputum is reliable and a simple technique for detecting mycobacterium in order to diagnose pulmonary TB. The method consists of microscopic examination of the specimen of 3 morning successive sputum have been spread on a slide and stained by Ziel-Nielsen methods and aromine rhodamine stain. Focus under fluorescent microscope. Under the microscope, we seen pink color rod-shaped bacterium with a dark background. Finally, we get the pink color rod-shaped organisms, nothing but a tubercle bacilli. In this way, we have to identify the tubercle bacillus. Next, we enter tuberculin skin test (TST). Montex tuberculin skin test is a skin test for identifying exposure to the TB bacteria, Mycobacterium tuberculosis. In this Montex test, 0.1 ml of tuberculin is injected to intradermally. Most people's infected Most peoples infected by Mycobacterium tuberculosis are vaccinated by BCG with a reactive TST and develop an induration at the site of the injection. The diameter of this duration is measured after 40 to 72 hours. In this duration, the diameter 10 millimeter or more is considered as positive, and 5 millimeters considered, and 5 millimeter or less than 5 millimeters considered as a negative. Next, we enter the treatment. How to treat the patients? First, we have to choose chemotherapy as revolutionary the management of tuberculosis, because the treatment of TB uses antibiotics to kill the bacteria. The two antibiotics, that is rifampicin and azoniazid, most commonly used one. Instead of short course of antibiotics typically used to cure other bacterial infection, TB require more longer period of treatment, around 6 to 12 months, to entirely eliminate mycobacterium from the body. In this serious stage, it may be used multi-drug therapy. To treat TB means taking several different anti-tubercular drugs at the same time. Some of the antibiotics may also be used to treat this disease. Now we used DOT, directly absorbed treatment, is very useful to treat the TB containing patients. Next we enter prevention. For this prevention, how we are prevent this disease? For this prevention of TB, generally measures such as adequate nutrition, because the healthy person, we don't receive very earlier to this disease. Very earlier you didn't receive very earlier receive this disease, because we are the healthy person, and we have the awareness of health educations, and also we wear cover the mouth cover the mouth and wear mask, wash your hands frequently, are very important measures. And the intradermal injections of live vaccine BCG, uh, Bacillus calmette urine. Immunity lasts for 10 to 15 minutes. Thank you. Thank you. Thank you, everyone.